Poštovani gledalci, dobar dan i dobrodošli u novu epizodu serijala Balansom do zdravlja. Danas imam izuzetnu čast da ugostim doktorku koja nam dolazi iz Švedske, koja se bavi istraživanjima u oblasti ishrane i suplementacije. Njena specijalizacija je u oblasti esencijalnih masnih kiselina i danas ćemo za temu imati pre svega ishranu i suplementaciju i razvoj dece od najranijih doba i ishranu i suplementaciju kod trudnica. Današnji gost, dr. Emmalee Gisslevik. Emmalee, welcome to our show.
Thank you. Very nice to be here.
Thank you very much for spending your precious time with us. It's always a pleasure to get the good advices with you today. As I already explained to our public, the subject is diet and nutrition and everything that we can do in order to help our mothers to help development of the children from the earliest ages.
Very important subject.
Yeah. So can you tell us something about the importance of good nutrition and the importance of the supplementation for the development of babies and children?
Absolutely. And it's a very important topic, one that is very close to my heart, since we know that the health of the children starts already in the womb of the mother. And also a topic that sometimes is lost is also the health of the mother. That you can see health advice or dietary advice to the mother in order to get the baby healthy, but not often you will see advice on how the mother could keep healthy for herself and also after the pregnancy. But if we just start with the baby, the health starts already in the womb with the nutrition that the mother is giving. And here we have a misconception that the baby will get everything from the mother, the source of the mother, so you don't need to eat anything special because the baby will get what it wants. And that's almost true, because the baby will draw or a signal to get the mother's nutritional stores. So for example, if the mother is not eating enough calcium, then the calcium will be drawn from her bones. So the baby will get that, but the mother's bones will have less calcium, which will become a risk later in life for her. But in other cases, for example, with the special fats that you get from fish, for example, fish fats, the same example will happen, that the baby will draw from the mother's stores, but if the mother doesn't have that stores, the baby will not get enough. So it's not true that the baby will get everything it needs, although the mother wouldn't eat anything special or add anything. And here there are some specific nutrients. And I'm sure you have heard of them and know them, but we have folate. That's a more known nutrient that almost all countries have recommendations for the mother to actually have before pregnancy, if it's possible, to start supplementing actually with folate before pregnancy and 3 months into the pregnancy. And that's for the neural development, so to avoid neural tube defects.
So if we talk about, you mentioned fat, so if we talk about fatty acids, and if we know that 60% of our brain is made of fatty acids, does this what you have just said means that, okay, if mother does not take supplementation, and then the baby does not have enough, for example, fatty acids, it will take the fatty acids from the mother's brain,
Yes.
which means that the mother's brain can be damaged.
Not necessarily damaged, but it will have a reduction of those fatty acids. DHA, for example, is the name of one of the two fish fats, and DHA that we have a lot of in the brain. So it would actually draw the DHA. They have seen, researchers have seen that the amount of DHA decreases in the mother's brain if she hasn't added extra in her diet. And these are, you are able to get them back after pregnancy. It can take up to a year, probably longer if your diet does not contain anything, but that can be that is one of the reasons for mother's brain fog or reason for feeling down or depression or a little bit confused. The baby brain is the word that you often talk about.
Yeah.
So that's one of the reasons.
So when we talk about something that is common in Serbia and Balkan countries, is that some of the pediatricians will advise nursing ladies to use the supplements and to give the supplements to children after they have just been born. But some other pediatricians will say, no, this is not needed. It's enough to take everything from the food, from the healthy food. And some of them will just say, okay, we cannot take the same food and the same supplements and as people in Scandinavia or people in the other continents. What is your opinion about this?
Regarding vitamin D and omega-3 fatty acids, we have in the Nordic countries where I'm familiar with the rules and how you recommend. The baby needs to have DHA as soon as it's born. And if you are breastfeeding, then that will hopefully be enough if the mother have had a diet with DHA, because that can also be depleted. We have different levels of DHA in breast milk. If we look at the whole world, we will see countries with women with really low levels of this fatty acid from fish that's very low. So in those cases, it would be beneficial to add to the baby extra, so they get the 0.3% in breast milk as recommended. And also, if you're not breastfeeding, then at least in Sweden and Norway, they recommend that you get a replacement formula that has DHA in it. So for those countries that I'm working, it's very important to ensure this, and also vitamin D, which is also connected to fish consumption, because fish is the only, not only, but the best dietary source of vitamin D. And you get it from the sun, but fish is the biggest source from the diet. So in the Nordic countries, we don't get vitamin D from the sun half of the year. We need to have it through diet. And if you don't eat fish, then you will have problem of getting enough vitamin D. So that's why we have a recommendation that all children get vitamin D drops from birth.
Actually, what I know from official sources is that around 80% of people in the Balkans as well have a lack of D vitamin. We have more sun, but we cannot use a D vitamin from the sun in such a quantity. So let's say around 80% are lacking, and the other 20% are even in the stage of hypervitaminosis because they take the vitamin in overdosed, like in big dosages. So we are our countries are, let's say, in disbalance in in every way. But when we are talking about the other supplements and the fatty acids, what is your opinion? Should we take the food only from the sources, local sources, or it is good to take, for example, usually the Scandinavian countries are famous by a lot of food that is rich with omega-3s, and in our area it's not such a case. Do we need some nutrition or some food from the other regions?
I can quite confidently say that we do need to supplement, and the reason why I say this is that I've spent the first half of my career to try to get people to eat more fish and to get the natural sources. And this is a huge problem because you cannot just start to eat fish if you haven't had the experience taught to you, or if you have a school that tell you that it's important how to cook it and where to buy it. It needs to not be overpriced, and we just don't get to the levels of eating enough foods. And since we want to actually help people here and now, I do recommend to take supplements, fish oil supplements. And here it needs to be this, how to call it, whole food supplement. So try to find supplements that have as much as possible of the nutrients from the fish oil, natural fish oil, rather than the concentrated versions. And there you also will get the vitamin D, if it's a good quality food supplement, in the amount of what you would have in a portion of fish. So the dose is a portion of fish in both the fats and in the vitamin D to take. So you don't need to worry, and also about contaminants and other aspects that pregnant women and also mothers and fathers are worried about when it comes to their children. That will disappear if you add in food supplements. But continue to eat fish and try slowly to also start getting that into your diet as well.
So this means that to our small children also we should give them as much fish as it is possible and fish oil supplements. But should we add some multivitamins or not? Or what's your recommendation about other supplements?
First, I just want to add that the newborn babies should have a special supplements either from a different formula or from the breast milk. That's a special combination for them. But as soon as they start to eat solid food, that's when you can also add regular fish oil, because that's when they would start eating regular fish. So that's a time for regular fish oil as well. And regarding other vitamins and minerals, for the breast milk, you will get most of it from the mother. So it's that time is more of supplementing the mother, or make sure that the mother have a good balanced nutrition, I would say. But otherwise, I recommend that you can help with the fibers, not too much for small children, but also if you have extracts from different vegetables and fruits and so on, if you're not able to get that into the diet. But often that's the most easy part.
Yeah.
Yes.
So in any case, we should consult the pediatrician.
Yes,
And
always consult the pediatrician
yeah.
before starting supplement.
We should not play a doctor by ourselves.
No.
True.
And also, a very good way to know is to test, because we don't need to guess anymore, since there are so many available tests out. You perhaps have a doctor that can test the mother, for example. If you're breastfeeding, you can test the mother for her levels of omega-3s and vitamin Ds, and then you know that the baby gets the same, so you don't have to test the baby.
Yeah.
But when they get older and if you're worried, there are tests to buy for nutrients deficiencies, or home, or you can go to the doctor and ask if you're worried.
So during the breastfeeding period, we should actually have everything that is necessary for the mother, and if she has enough milk, it will be enough for the child. When that period passes, then we should take care of the children, and their development will depend on the dietary supplement as well. And for all of that, of course, we need to consult our pediatricians and mother's doctor, yeah?
Absolutely. But with really small children, you will actually get quite easily get all that you need from the food, and also together with perhaps formula. Often you have both formula for the nap times and try different foods. So in the beginning, I would not stress about other than fatty acids, other supplements for children. So just try as much as possible to get the nutrients from food when they're small. When they're above 2 and you start to see patterns, perhaps they get into their neophobia stage. That's a stage when they are afraid to test new things, and you feel scared about they are excluding some types of foods. That is a time when I believe you can start thinking about supplementations for other nutrients, minerals, vitamins, and so on.
So actually the directive that we have from the European Commission to take extra D vitamin and fatty acids for small children is not just accidentally given.
Exactly, it's not accidentally, it's very important, and I have a huge impact on both the mother and the child's development, and especially brain and cognitive development and neurological development.
Yeah. And also, if I understood you correctly, we should not be extreme in on the other way, so we should not give to the child too much supplements, and some multivitamin supplements, etc., are not needed actually, at least before they reach to age.
Precisely.
2 years
That's my
age.
recommendation. And to keep fighting with the food before this, and also after that, yes.
Okay, this is very important for our people. A lot of people think that they know enough, and that some of them will not consult the doctor, some of them will give everything to the people, and some of them are on the contrary, they will not give anything to children. So actually we need to be in a balance, not give too much, but also need what's really necessary from the early ages.
Yes, that sounds optimal, if you can find that balance.
Thank you very much for these wonderful advices.
Thank you.
It means a lot to us, and it will mean a lot to our mothers and fathers as well. And thank you for spending this beautiful day in Oslo with us. Dragi gledalci, to je bila naša draga gošća, dr. Emmalee Gisslevik. Hvala na pažnji.